Hi, it's Karen Damsho with Damsho Financial Planning, here with this week's Medicare and a health insurance update. So this time of year, find that I start getting a lot of questions and requests for primary care physicians. And we know that the landscape of primary care physicians has changed quite a bit in recent years. So I wanted to just give you a couple of quick tips about how you might go about finding a new primary care physician if you need one, and some things to think about primary care physicians. So the purpose of a primary care physician is really to help kind of be that point person who coordinates all of your medical care. And many of your insurance plans require you to have a primary care physician, and there may be a need for referrals that may come from that primary care physician to specialists. But one of the things we know is we don't have nearly enough primary care physicians in Tucson to meet the need. So if you are thinking about changing your PCP, then I would encourage you to make that decision well in advance of when you might actually need to see a new primary care physician. So you can certainly reach out to your friends, your family, your colleagues, ask for some recommendations of who maybe other people have seen and they've liked. We have some great kind of medical centers here in town now that have a number of primary care physicians in those group practices, or maybe even a practice, one of the big ones like TMC or Banner, where you have lots of doctors within that kind of environment to choose from. I would say the average wait time to get in to see a new primary care physician in Tucson right now is probably 4 to 9 months. So like I said, if you think you want to make that shift, make sure that you don't need to go see somebody right away, because it could take you some time to get in to see the new primary care physician. So I would encourage you, if you have an existing primary care physician, maybe you take care of doing things like getting referrals that you may need for a number of months, getting your medications filled for at least 6 months so that you can make sure that you have all of that in place before you switch physicians, and then it takes you a while to get into the new one. Depending on your insurance, they could require you to select the new primary care physician before you can even make an appointment with them. So lots of little hoops you may need to jump through, but I know the PCP is so important to all of you. And as always, if you have any questions, please feel free to reach out and ask me. And if you have a question you would like me to address, please reply to this email, and maybe your question will be featured in one of my next videos. I'll see you again next week.